Did you know that nearly 55 million people worldwide are living with dementia, and that a new case develops every 3 seconds? Even more concerning, dementia has now become the 7th leading cause of death globally. But here's what most people never hear. In many situations, this decline in brain function isn't simply the result of aging or genetics. Shocking new research shows that some of the most commonly prescribed medications, yes, the ones sitting right in your cabinet, may actually be quietly harming your brain. For adults over 60, these drugs could be shrinking brain tissue, speeding up memory loss, and even contributing to Alzheimer's disease. The scariest part? You might be taking them every single day without realizing what they're doing to your mind. In this video, we're uncovering 9 widely used medications that scientific studies have linked to rapid dementia symptoms. Be sure to watch until the end, because the number 1 medication on this list is the most dangerous, and it's prescribed constantly, even though very few people know how damaging it can be. And don't worry, we won't leave you with the bad news only. At the very end, we'll share 3 science-backed foods proven to help prevent dementia and support long-term brain health naturally. Before we dive in, let us know in the comments where you're watching from. And don't forget to like this video and subscribe for more content like this. Now, let's get started. Medication number 9, first-generation antihistamines. Many older adults reach for common antihistamines like diphenhydramine, found in Benadryl, to handle allergies, colds, or difficulty sleeping. Though they appear harmless, these drugs belong to a group called anticholinergics. They block acetylcholine, a neurotransmitter that works as a messenger between brain cells, especially for memory and learning. When its levels drop, brain fog increases, forgetfulness becomes more frequent, and over time, the brain can literally begin to shrink. A study published in JAMA Internal Medicine found that seniors who took strong anticholinergics daily for only 3 years had a 54% higher risk of developing dementia. What's frightening is how quietly it begins, misplacing keys more often or forgetting simple appointments. Because many of these drugs are sold over the counter, people assume they're safe. But for aging brains, they can be incredibly harmful. Medication number 8, benzodiazepines. If you've dealt with anxiety, insomnia, or muscle spasms, chances are you've been prescribed a benzodiazepine. Medications like Valium, diazepam, Ativan, lorazepam, and Xanax, alprazolam, fall into this category. They work by boosting GABA, a neurotransmitter that slows brain activity and creates a calming effect. But the brain doesn't handle long-term slowing down very well. Research published in the BMJ reported that individuals taking benzodiazepines for more than 3 months had a 51% increased risk of Alzheimer's disease. Many older adults start taking them for sleep and unknowingly continue for years, not realizing the cognitive cost. You may feel groggy, slower to react, or struggle to follow conversations. These aren't just aging, they're warning signs. Medication No. 7. Proton pump inhibitors, PPIs. Millions of seniors take PPIs like omeprazole, Prilosec, pantoprazole, or esomeprazole, Nexium, for acid reflux or heartburn. While effective for stomach issues, studies show they may contribute to cognitive decline. By blocking stomach acid, PPIs reduce absorption of nutrients like vitamin B12 and magnesium, which are essential for brain health. A German study involving over 73,000 seniors found regular PPI users had a 44% higher risk of dementia. Many people stay on these medications for years without realizing they might be depriving their brain of crucial nutrients. Medication number 6, antipsychotics. Powerful drugs like risperidone, olanzapine, and quetiapine are sometimes used to manage symptoms in dementia, schizophrenia, or bipolar disorder. Ironically, while they may calm agitation, they can also accelerate cognitive decline. Antipsychotics alter dopamine and serotonin levels, often leading to sedation, emotional dullness, and reduced brain activity. The FDA has a black box warning for their use in elderly patients with dementia due to increased risk of death. Even seniors without dementia may experience worsening memory, diminished social engagement, and reduced ability to perform daily tasks. Medication number 5, sleep aids, Z-drugs. As sleep becomes more difficult with age, many seniors turn to sleep aids like zolpidem, Ambien, Eszopiclone, Lunesta, or Zaleplon, Sonata. Known as Z-drugs, they help you fall asleep by slowing brain activity, but they disrupt the brain's natural restorative sleep cycles. They can reduce REM sleep, worsen morning grogginess, and contribute to memory problems. A BMJ study showed seniors using Z-drugs had a significantly higher risk of dementia and dangerous falls. Feeling foggy in the morning isn't just poor sleep, it's your brain struggling from nightly sedation. Medication number 4, tricyclic antidepressants. Depression is common in older adults, but older antidepressants like amitriptyline and doxepin can have strong anticholinergic effects, blocking acetylcholine and impairing memory. The aging brain is especially vulnerable. A 2015 JAMA study found a dose-dependent relationship: the higher and longer the use, the greater the dementia risk. Many doctors still prescribe them despite safer options. If confusion or memory issues appear, the medication, not the depression, may be the true cause. Medication number 3, bladder control drugs. Overactive bladder is common among seniors, leading to prescriptions for oxybutynin, tolterodine, or sulfenacin. These drugs are also potent anticholinergics. A UCSF study found that seniors taking bladder control medications had smaller brain volume and poorer memory performance. These drugs can be taken for years, often without anyone monitoring the cognitive side effects. If thinking feels slower or planning everyday tasks gets harder, these medications may be to blame. Medication number 2, statins. Statins like atorvastatin, simvastatin, and rosuvastatin are among the most prescribed drugs for seniors. While they protect the heart, they may also impair brain function. Your brain holds 25% of the body's cholesterol, which is essential for neuron integrity. By lowering cholesterol too much, statins may disrupt neurotransmitters like serotonin and dopamine, affecting memory and focus. According to the journal Pharmacotherapy, 75% of patients who experienced memory problems improved after stopping statins. They save lives, but if memory issues arise, a dosage or medication adjustment may be needed. Medication number 1, anticholinergic combination drugs. At the top of the list are anticholinergic combination medications. These aren't single drugs but combinations that stack anticholinergic effects, like cold and flu meds containing diphenhydramine, GI drugs with scopolamine, or muscle relaxers such as cyclobenzaprine. One long-term study following 3,434 older adults for 10 years found that high cumulative anticholinergic use increased dementia risk by 54%, even if patients stopped years before symptoms appeared. These medications act like a slow, silent toxin, especially when taken together. Now that we've covered the hidden dangers, let's move to something more hopeful. Research shows certain natural foods can support brain health, reduce inflammation, and help lower dementia risk. Here are the top 3. Food number 3, blueberries. Often called brain berries, blueberries are rich in antioxidants known as anthocyanins, which help protect brain cells from oxidative stress. Studies have shown they can improve memory and delay brain aging by up to 2.5 years. In one study from the University of Cincinnati, older adults drinking blueberry juice daily saw significant memory improvement in just 12 weeks. Food number 2, fatty fish. Fish like salmon, sardines, and mackerel are high in omega-3 fatty acids, especially DHA, a key structural component of the brain. It supports neuron health and reduces inflammation. A major study found people who ate fish once a week had a 60% lower risk of Alzheimer's. 2 servings a week can make a massive difference. Food number 1, leafy greens. Spinach, kale, and collard greens are packed with nutrients like vitamin K, lutein, folate, and beta-carotene. A study in neurology found that people eating 1 to 2 servings daily had the cognitive ability of someone 11 years younger. These greens help keep the brain sharp and resilient. If you're a senior or caring for an older loved one, this information is invaluable. We often rely on medications to help us feel better, sleep better, or manage symptoms. But sometimes those same pills quietly harm the brain. Dementia doesn't appear overnight. Its warning signs often begin subtly: misplaced items, forgotten names, missed appointments. The good news? Now you know what to look out for. You can take action, talk to your doctor, explore safer alternatives, and strengthen your brain with the right foods. Preventing dementia starts with awareness. Now we'd like to hear from you. Have you or someone you know experienced memory issues while taking any of these medications? What brain-boosting foods have you added to your routine? Share your thoughts in the comments, we love reading them. Thanks so much for watching. Music,